Yes. So what would you say needs to change or to improve when we talk about providing skilled breastfeeding counseling?
We need to make sure that there are enough people who are given the time to do the work. And that's why it's often particularly helpful to have lay women in from the community who can give mothers more time. But it is also very important that they are supervised, that they are that they are trained, and that they are supervised by more experienced people, such as health workers, perhaps midwives, community midwives, health visitors, who are also themselves trained. They won't necessarily have the skills unless they're specifically trained to have them, to supervise the mothers and to make sure that they know what they're doing, that they are able to use the competencies that they've been given, that they understand what they have to do, and to, as well as doing the sort of administrative side of supervision and seeing how many times they've seen mothers, how many mothers they're seeing, if they're seeing them often enough, and whether they are able to do what they're supposed to do. They also need to give the mothers, give the breastfeeding counsellors a little mentoring, go on teaching them the skills and helping them when they have a problem to see how they could help it, and if it happens again, then they could help another mother in that way, working alongside them and going on teaching them. It's very difficult in a training course to give the breastfeeding counsellors enough practice to learn all the competencies that they need to develop fully. And so to have ongoing, in their supervision, ongoing help to learn those competencies and to become confident in them is very important.
So it's also about building confidence in the breastfeeding counsellors themselves.
Absolutely. Building confidence, yes. And having the chain of the cascade of training from senior people at central level to down to the supervisors of the counsellors and the counsellors themselves.